Karibu sana. This is Morning Cafe. News to Stanley Nyerengeti. It's a Monday, and around this time we discuss matters health. And our conversation for today is a conversation that has been happening in the country for quite a while. Endometriosis, you probably have a glimpse of what it is, but then this morning we have an expert to tell us what really it is. Just taking a look at and breaking it down, and even allowing you and giving you the opportunity to share in with your experience, and also ask any kind of questions that you have. That is our question for the day for you. Do you have any questions regarding endometriosis, or would you like to share your experience? 0795 045 864 is the number to call us live. 0793 267 279 is our WhatsApp number. Dr. Bruce Samo is an obstetrician as well as a gynecologist. Karibu sana.
Thank you so much. Thank you for having me.
Oh yes. So today I want us to break down this conversation,
right,
and this condition bit by bit, because I mean it has been happening in the country. This conversation has been going on. People are really wondering what endometriosis is after losing TV star Fire Mama Njombe. So first off, what is, even as you also give us your introduction, who is Dr. Bruce, what is endometriosis?
Right. My name is Dr. Bruce Semo. I'm an obstetrician and gynecologist, and very keen, developed an interest in what we call laparoscopic surgery, which majorly is one of the approaches to the management of diagnosis and diagnosis of endometriosis. Now, before we discuss endometriosis, I think it's very important that we understand the anatomy, or rather the structure of the female pelvis.
Yeah.
Okay? And one of the major structures of the female pelvis that we will delve on today so much is the uterus. Okay? And so the uterus is actually a pear-shaped organ that is normally in the female pelvis, and it has a cavity inside. Now, this cavity has three connections. Okay? So we have the lower part of the cavity, which is actually the opening of the uterus where the blood normally flows out during the menstrual cycle. This is the cervix. And then on the upper part, we actually have two connections, which is the fallopian tubes. So the fallopian tubes actually open into this cavity of the uterus. Now, the inner cavity of this uterus has a special lining inside, which is the one that majorly is involved when it comes to the menstrual cycle. Of course, there's a lot of factors that come into play when menstrual cycle is involved. Now, this cavity, the lining of this cavity, is what we call endometrium. So it has special cells, and these cells are normally responding to hormonal changes during the menstrual cycle. And at the end of the menstrual cycle, in the event that a woman does not get pregnant, then it is the one that sloughs off and sheds through the cervix, and we call that menstruation. Now, in the event, for whatever reason, we have some of these cells being found outside the uterine cavity. Okay? So ectopic uterine tissues, then we say that is endometriosis. So endometriosis is a condition that is characterized by ectopic functional endometrial cells and glands within the outside part of the endometrial cavity. So that is what is called endometriosis.
Right.
Okay.
So despite the fact that quite a number of medics would say the cause isn't really known, but then there have been studies over and over to really try and debunk this. So according to even the World Health Organization, and I want you to also help us debunk this, because even as someone who probably knows my loved one has endometriosis, or even them themselves, they definitely go to Google and try to really search what is the whole root cause. So one of the causes, according to World Health Organization, saying retrograde menstruation, when menstrual blood containing endometrial cells flows back through the fallopian tubes and into the pelvic cavity at the time that blood is flowing out of the body through the cervix and vagina through periods, as well as cellular metaplasia, and stem cells can give rise to the disease, which then spreads through the body via blood and lymphatic vessels. So it gives about three of them. Help us understand, let's say, this particular causes that WHO outlines for us.
Yeah, so there's no really single identified cause of endometriosis, and it's something that a lot of women normally struggle with. Every time you tell a woman that she has endometriosis, the first question that normally comes back is, what causes it? Okay? There are theories that have been brought about to try and explain how we end up with endometrial tissue outside the endometrial cavity. So the first theory that has been put across is the Samson's theory. What says that there is normally retrograde menstruation, meaning at the time when a woman is menstruating, instead of the blood flowing through the cervix and out through the vagina, these sloughed-off tissues of endometrium and blood sometimes tend to retrograde, to flow back through the fallopian tubes and into the peritoneal cavity, where they attach on different structures, like the ovaries, the ligaments, and sometimes even the bowel. Okay? So that's the first theory. But this theory does not explain to us how we end up with some type of endometriosis in different places. Like, for example, if it was retrograde menstruation, then how do we explain having, endometriosis in the lungs or even in the brain? There's some people who've been found to have endometriosis in the brain, in the eyes. Okay, so endometriosis can occur in so many places. And the other theory that maybe tries to explain that is something called coelomic metaplasia. Okay, which basically just means that there are some cells in some areas which undergo some changes to become endometrial cells. Okay? And this can explain how we end up with endometriosis in the pleural cavity, can explain how we end up with endometriosis in the bowel and these many other areas. But there are other factors also that have been brought up to explain. There's a genetic predisposition to development of endometriosis. They're what we call stem cells. Stem cells are the youngest cells at the time a human being is developing. Yeah. And some of them have been thought to be, left behind at the time a human being is developing. And these cells have the potential to grow and become any type of cell. Okay? And when that happens, then we say that they might have that propensity to develop and become endometrial cells within the area where they were left. And then they start acting and responding to the hormones which are being released and acting in a manner likely to be the ones that are inside the endometrial cavity. So
the chances of even endometriosis being hereditary, right?
Yes. The chances that if you had a relative who has endometriosis, the chances that you will have endometriosis is actually 7 times higher. Okay? So there's a genetic component to it. So we think it is actually a constellation of all these factors that predispose one to have endometriosis. But there is no single point factor that we can say this is exactly the reason why you have endometriosis.
Right. Yeah. So typically, when does it start to occur for someone who has endometriosis?
Unfortunately, and especially in our local setup, the diagnosis of endometriosis happens very late. So a lot of times we catch the disease when the patient has actually been suffering for quite some time. The average has been known to about 7 to 10 years. Probably in our setup it is even higher for several reasons. But it is a disease that is known to be affected by, the growth and the response of the endometrial cells is actually hormonal. So it is the reproductive age group, okay? So we don't say that women or the ladies who are at school don't have endometriosis. They may have endometriosis, but in the early phases. But women between 35 to 45 years of age are the ones who are commonly being diagnosed with endometriosis. And sadly, most of them, by the time they're being diagnosed with this condition, it's normally a state when they have been suffering through so long that we come up with the diagnosis of endometriosis.
So typically in your many years of experience, really, how, at what age, the younger age, can some of this, the prevalence of it start?
One of the challenges of making diagnosis of endometriosis is that the symptoms are very vague. Okay? And so we have even seen it in girls who are 13 years old, 14 years old, who are going through their menstrual cycle. But if you look at the presentation of endometriosis, so endometriosis presents with 4 common features. So number 1, these patients will present with pain. And the pain is very vague, okay? So most of them will go to hospital and then they're being diagnosed with urinary tract infections. Some of them have even been labeled to be having sexually transmitted infections. They may present with bloating. I'm sure you've heard of some group of women who are always walking around with painkillers, paracetamol and diclofenac in the bag. And there's this socialization of our young women, especially by our elder mothers and our grandmothers, to believe that pain during the menses is normal, okay? And so we are seeing it in high school girls. If you're keen, you'll notice that there are some girls who at the end of every month, they're always out of school. They're in hospital getting, painkillers, injections, and being admitted for all manner of things. And they're being labeled as having low threshold because, menstruation is normal, right? And menstrual pain is normal. That's what we are telling them. What we don't know is that most of these patients who actually have excruciating pain during their menses may actually be having very early phases of endometriosis that we don't know about. In the late phases, most of the time, the women will come with infertility, because that's the other thing that has been caused by endometriosis.
So how do you, and how does the medic then label these phases? Does it go with the pain threshold? How do you say this is the first phase, this is the second phase, these are the late phases? Does it go the pain threshold?
So because of the variety in presentation, depending on the location of the area that has been involved with endometriosis, the diagnosis of endometriosis depends, number one, on the symptoms. So we need to be very cautious about the symptoms, and we need actually a lot of advocacy on women. We need to tell women that it is not normal to have excruciating pain during your menses. Okay? They present with pain during menstrual flow. They present with pain during passing of stool or during passing of urine. So when you put these symptoms together, then you can actually come up with a clinical diagnosis of endometriosis at a very young stage. But there is no stage-wise development of endometriosis. There are some patients who are actually asymptomatic. They don't have any symptoms, but they have endometriosis.
Right.
And then there are some who actually have very vague symptoms like bloating or pain when they're passing stool, early satiety, or some that will just present with chest pain or shoulder pain, and they actually have endometriosis. So there's no staging of what endometriosis is. But there are common classifications, different type of classifications that have come up. So you'll find we have what we call peritoneal endometriosis, depending on the location. The most common one, which is the ovarian endometriosis, and you see a lot of women coming in and they say they have ovarian cysts, which is another discussion all in all. And then you can have what we call deep infiltrating endometriosis. This is the most advanced stage that in most cases may require surgery. Yeah.
Right. And take a look at, let's see, even some of this. So can we call them the types? The one that you mentioned, the superficial, the cystic ovarian, the deep endometriosis.
Yeah.
So because you told us chances of, let's say, your relative having endometriosis, you're 7 times higher to also have it. So let's say someone knows that, well, my auntie had endometriosis, or probably has, and for her it was maybe, let's say, the brain, or maybe for the lung. Will chances be the same that this person will also have in the same location?
No. That's not how it works. Okay. Like we said in the beginning, that we don't really know what causes endometriosis. So we can't really predict that if your auntie had endometriosis, pulmonary endometriosis, that the chances you're going to have pulmonary endometriosis is higher. What we know is that you will have ectopic endometrial glands located in different places outside the uterus. Okay? Yeah.
Right. Let's talk about now the different diagnostic options. This person has come to you. And actually, even before, so they actually come to this health facility, can they themselves, let's say, know that I have endometriosis even before walking to the health facility? And even now, if they come into you and they say, hey, Daktari, I feel like I have these symptoms that you have told us. What kind of diagnostic options would you provide for them?
There has been a lot of advancement in the manner in which we are making diagnosis of endometriosis. But of course, the first thing is to understand the symptoms, okay? So let us advocate for women, number one, that it is not normal to feel pain during menses, because that is one of the most common presenting symptoms, okay? So we look at the symptomatic presentation first before we do any investigations. So women who are having pain during their menses, women who are having pain during intercourse, women who are having heavy menstrual bleeding, okay? Women who are having either bloating or pain during passage of stool, women who are having pain when they are passing urine and they've been treated for several years for urinary tract infections, and they keep coming back and they're saying, this thing keeps on getting treated, it disappears and it comes back, okay? So those are signs that would already point to you that there's a possibility that this patient actually has endometriosis. Now, in the past, and this has been one of the problems that we are facing in this country, was that the diagnosis of endometriosis was done, the confirmation that you have endometriosis was actually done through a process called laparoscopic diagnosis. So this is a process where there is actually a small camera that is put inside the abdomen with light, and then they distend the abdomen using some special gas. And through visualization of the structures inside the abdomen, they can actually be able to see these endometrial cells. Okay? But currently there has been a lot of discussion about the invasive approach to diagnosis of endometriosis. So the current approach is actually a special type of ultrasound diagnosis. Okay? So the types of ultrasound equipments that we have come up with have actually changed, and now endometriosis can actually be diagnosed through ultrasonography. And it's actually the gold standard for diagnosis. But unfortunately, it depends on the location of the endometriosis also, number one. And two, there is a lot of lack of training in use of ultrasonography, because ultrasound diagnosis is user dependent. So there is very vigorous training involved for someone to be able to make the diagnosis of endometriosis using an ultrasound. So the other thing is we can also do magnetic resonance imaging, but you can imagine the cost of that, and especially for the people in the low-income communities, not being able to afford it. So based on that, most of the time the diagnosis is normally made on the clinical presentation. And once we do the clinical presentation, then we do a presumptive diagnosis and we initiate the treatment. Okay? But right now we are encouraging a lot of training for the obstetricians and gynecologists to be able to pick endometriosis through the clinical presentation, and also be able to acquire that skill to do ultrasonography to be able to pick endometriosis among these women. Yeah.
Right. So even before you continue, a reminder to the viewer, 0795-045-864 is the number to call us live. It's just below your screens right now. Save this number right now and tell us, rather ask those questions, all those questions that you have. I'm being told Lucy from Kinangop. Lucy, habari asubuhi.
Nzuri sana.
Thank you for calling us this morning. Do you have any questions or comments?
Nilikuwa nauliza.
Yes, you could probably have the sound up kwa studio.
Nilikuwa na uchungu sana when I'm having my menses.
Yes.
And every time lazima niende kwa daktari nidungwe sindano. Every month when I'm having my menses. Inaweza kuwa ni endometriosis. Hello.
Yes, Lucy. Tumepata swali yako. Daktari will be answering your question in a few.
Okay.
Thank you very much.
Most common presentations that women come with in the clinic. Now, while there is a high probability that it could be endometriosis, we must understand that there are many other causes why a woman will feel pain during her menses. Because we have issues like uterine fibroids, okay? We have ovarian diseases. We have conditions involving the colon, the bowel, and the rectum that can actually cause pain during menses. We have congenital abnormalities. So the best thing that I normally advocate is that if you realize that you are experiencing pain during menses, then the best thing is actually to get professional advice from a specialist to be able to actually make that diagnosis. Like we said, there's a history that they have to connect, and then there are certain investigations that they have to do for them to be able to initiate the treatment. But if you are having pain during your menses to an extent where you actually need to go to hospital to get injections, and this pain is constant and it has been lasting for more than 6 months, then the chances that you're having endometriosis is actually quite high.
Okay.
Yeah.
Right. We have another caller all the way to Mombasa. Ruth, habari asubuhi.
Salama, umeamkaje?
Sisi tumeamka salama hapa studio. How is Mombasa?
Mombasa is cool.
Kuna swali au kuna maoni?
Niko na swali na nawashukuru kwa hichi kipindi.
Thank you very much.
Maanake I've suffered urinary tract infection for the last 14 years. Salama.
Tafadhali Ruth, mute TV ama pale unatusikilizia. Mute ama uzime ndio tupatane vizuri.
Aya.
Umefanya hivyo?
Unanipata?
Yes, tunakupata. I hope umemute ama umezima.
Nimemute.
Thank you very much. Uliza swali sasa.
Sasa hiyo UTI imenisumbua sana. Sijui nitafanyaje
Sawa. Ruth, naambiwa tafadhali mute tena, then you can call us back. Ruth from Mombasa, and ask us those questions. 0795-045-864 is the number to call us live when you're calling us from. Wherever you are, tell us your name, where you're calling us from, and tafadhali just mute your TV or have it off so that you can have a seamless conversation with you. The number to call us live is just below your screens. 0795-045-864 as you have this conversation on endometriosis. Ladies, you can also tell us, how do you deal with the whole period symptoms? When it really gets painful, as Dr. says, we shouldn't really normalize it. But what do? You can also share with us your experiences on the same. So I had cut you short, the previous question from Nairobi.
Yeah, so when we are talking about pain during menses, the one thing that we have to understand is that there are many causes of pain during menses, okay? And so we can't say any woman who has pain during her menses has endometriosis. Pain during menses is called dysmenorrhea, okay? So there are two types of pain during menses. So there's what we call primary dysmenorrhea. This is pain that happens during menses. It is not very severe, but it is actually something that still needs attention. It needs treatment, okay? It does not have any pathological cause. The main reason is because of the chemicals that are being produced in the uterus during menses that causes extreme contraction, what they normally call cramps, okay? But it is not so severe to an extent that it impacts, your social life or your daily quality of life. Then we have secondary dysmenorrhea, which is the secondary pain that women experience during menses. And this is where endometriosis comes in. So most of these women normally have endometriosis, but because of the socialization, they've come to believe that it is normal to experience pain during menses. So my question normally is, how normal is normal for a woman to have pain?
What's the threshold?
Okay? What is the threshold? So if a woman is always missing work 2 to 3 days every month because she's in pain for her menses, yet other women are coming to work, you see there's already a lot of stigmatization. We are appendicazi. That's what they say. But these people could be having other conditions that are causing secondary dysmenorrhea. Endometriosis is one of them. Uterine fibroids, depending on the degree of involvement. We have infections, pelvic inflammatory disease, okay? We can have conditions involving the bladder, okay? So just because you have a condition that is causing pain when you're passing urine, it does not mean that you have urinary tract infection. There are many other diseases of the bladder that can actually cause pain during menstruation. And unfortunately, most of these women normally label themselves as having urinary tract infections for a very long time.
Right. We have another caller. I believe it is Jeff from Nairobi. Jeff, habari asubuhi. Joy kutoka Nairobi. Habari asubuhi. Joy, kama unaweza nipata, habari asubuhi. Talk to us this morning. Right, ni kama Joy amepotea. 0795-045-864 ndio namba ya kutupigia simu sahihi as we discuss matters endometriosis. Do you have endometriosis? Do you know someone who has endometriosis? Would you like to share with us all those experiences, or is it something that you'd really like to know? And you have quite a number of questions. Kwa akili, Dr. Bruce will be answering them with you and just helping you understand this particular conversation. Ladies, also, you can tell us, how do you deal with the whole matters, as Dr. says, matters the whole period pain and the whole period symptoms? How do you deal with that? Talk to us this morning. Yes, sorry to cut you short.
Yeah, so that's it. So when we're talking about pain, we have to be careful, and we should not self-diagnose ourselves. Women should not self-diagnose themselves and say that, I have this urinary tract infection that has been treated for this long.
Okay.
The best approach will be to actually seek a specialist, attention, so that they can be able to also work with you and try and identify where exactly the problem is.
Right.
Yeah.
We have another caller, Tesi kutoka Kayole. Tesi, habari asubuhi. Stacy kutoka Kayole.
Okay, I'm Stacy kutoka Kayole.
Yes, unaweza paza sauti yako Stacy tafadhali?
Mimi niko na swali.
Yes, uliza.
I've been diagnosed na infections. Na nimepimwa vitu mingi sana like cancer. Nimepimwa PID.
Okay.
Na nikapimwa sensitivity ya urine.
Okay.
But sijawahi pata matibabu vizuri.
Right.
So nauliza daktari inaweza kuwa ni nini na nifanya nikuwe hivyo.
Okay.
Okay.
Asante sana Stacy kutoka Kawele. Daktari atakuwa na kujibu saa hii tu. Thank you Stacy for that.
As you can see, most of the stories that we are getting is I've been having this problem for this period of time. And I'm not getting, satisfied with the approach of treatment that I am getting. And it's a common story not just in our setup, but across the world. Women are going through pain, and there's a lot of trivialization of women who are going through pain. So for such a patient, I would advocate that she seeks care from a specialist who has, done a lot of advanced training in pelvic pain and preferably endometriosis. We do a lot of ultrasounds for women who have pain. But the problem is the people who are doing the ultrasounds have actually not been trained adequately to make a diagnosis of endometriosis using ultrasonography. And unfortunately, we have very few centers in East Africa in general that have actually been, allocated specifically for management of endometriosis. Endometriosis is not a one-man, war. It's actually a team of doctors who actually come together to actually be able to manage it and come up with a decision on what approach to treatment they should be getting. So if you have been treating yourself, or if you've been getting treatment for a certain condition for so long, then I'll advise that you actually seek treatment from an endometriosis specialist or an endometriosis center. Yeah. Right. Otherwise, the discussion of I have been having this pain for this period of time and it is not getting well, there is a series of approaches that we normally take. And so if we do the clinical diagnosis and we put you on treatment and it's getting worse, then we go to radiological diagnosis. So we do the ultrasound, we can do the MRI. But there's even an advanced approach, which is the laparoscopic diagnosis. So we can actually be able to do surgical investigations. Where we put the camera, like I said, and we actually be able to visualize the structures inside the pelvis and see what exactly is going on so that we can be able to understand where the source of the pain is coming from.
Right. Now getting to Mati's even surgeries, and I remember Njami Kukai before her death saying that she's undergone more than 20 surgeries. Yeah. And just even taking a look at even a number of people, endometriosis patients, saying they've undergone quite a number of surgeries. Why is this case that they have to undergo this amount of surgeries?
So if we go back to the pathophysiology, the occurrence, the manner in which endometriosis happens, we must understand one thing, that endometriosis has no cure. Okay? I'm not saying it can't be treated, I'm saying it has no cure, which means there's no way of completely eliminating the disease.
So again, there's a possibility of recurrence?
There is a possibility of recurrence. But even with that, there has been a lot of, a gap in the training of surgery for endometriosis.
Right.
And so you'll find most of these people who are going through these several surgeries, either the surgery is being done but they're recurring, or it is being not done but not adequately as per the required standards.
Right. Allow me to interrupt you there. Let's hear from Muthoni kutoka Olkarau. Muthoni, habari asubuhi?
Njema.
Thank you for calling us this morning kutoka Olkarau. Naomba utapaza sauti as you call us, as you ask Olkalau. Yes, ndio naambiwa ni Olkalau. Ukiuliza swali au maoni.
Hello?
Yes, tunakupata. Endelea na swali au maoni.
So I've been having this pain.
Okay.
I've been having this pain for quite a period of time.
Okay.
And when I approached a gynecologist, he said that it's because I'm fertile. That's why I get the pain, though it's not severe. I don't know whether to treat it severe or mild.
Right.
But I have to take some painkillers every second and third day of my menses.
Okay.
And sometimes I skip work. Sometimes it's not that severe. Is it true that it's okay to have that pain?
Okay. So thank you, Muthoni, for calling us this morning. Dr. has got your question, I believe. He'll be answering it in a few.
Right.
I think in each and every call there will be the whole perspective
you can see
of pain.
The pattern is coming out, that it is normally pain, Then after pain, normally it's either infertility that brings them to the hospital, or if it is not pain and infertility, then normally it is just a reduced quality of life because of missing work and all that. So infertility does three things. Number one is that it causes chronic pelvic pain. Number two is in the process of these tissues being outside where they're supposed to be, they cause what we call inflammation, which causes damage to the structures of the pelvis, which causes inflammation, and then infertility. So the treatment of endometriosis or chronic pelvic pain, once we've made the diagnosis, involves management of this pain, okay? And there are several medications that are actually used to manage this pain. Occasionally, most of these patients, you find that they have gone through a stepwise approach and they've taken so many medications for this pain, but they're not taking the right medication for the endometriosis. And then there's something that we're not talking about, which is a very strong factor of endometriosis, that it actually causes infertility. And a lot of times...
I was actually getting to there.
Yeah.
Now, even after the surgeries, getting into matters infertility, and according to symptoms by World Health Organization saying, I mean, we've mentioned this, the chronic pelvic pain, heavy bleeding during periods or between periods, and also trouble getting pregnant. And that was one point that I'd really want us to even focus on, the whole trouble getting pregnant. So does it mean even for, let's say, the lesions that probably would be, let's say, around the ovaries, would they damage the ovaries? Or rather, let's look at the ovaries, even the fallopian tubes, will they damage these locations? Tell us about that.
Yeah, so there are many mechanisms in which endometriosis causes infertility, although not all of them have been able to be elucidated. But one of the ones that we know is that endometriosis causes what we call inflammation. And inflammation is the body's response to foreign structures or an injury. And with that inflammation, then you start having scarring. Okay? So if you have endometriosis on the ovaries, then you find that it causes damages to the ovaries and it reduces the ovarian pool to an extent where now you either have subfertility or infertility. It can cause damage to the fallopian tubes, and the fallopian tubes are a very important component when it comes to fertility. The endometriosis itself, even if we look at inside the uterus for people who have endometriosis, they have a very foreign environment for a successful pregnancy because there are a lot of production of inflammatory mediators that make the endometrium not favorable for fertility.
All right. Well, getting back to that conversation on the infertility, let's pick this call first of all. Although to Kiserian, Carol, habari asubuhi. Carol, kama unanipata, tafadhali mute your TV or have it off and then talk to us this morning. Do you have a question or feedback? Carol, can you get me?
Hello, mi naitwa Carol.
Yes, thank you for calling us this morning.
Okay, mi niko na shida nimekuwa nayo for a long time. Just sasa ni 1 year.
Okay.
Na nimefanyiwa scan ya hiyo endometriosis.
All right.
Nimekuwa ni kila time nikihave periods na bleed kitovu.
All right.
Na imekuwa very painful.
Okay.
So sijajua nilishafanya CT scan but wakasema nifanye tena MRI.
All right.
So sijajua shida iko wapi.
Okay, so we have Dr. Bruce here and he'll be answering any of your questions. Probably kama uko na zingine nyingi, even after he answers, you can also call back for just make sure that amejibu vizuri ama for clarification of it.
Okay, sawa.
All right, thank you very much, Carol, kutoka Kiserian. It
goes back to the pain.
Yes.
So for how, what I'd like to say is that I want to clarify that there are different types of ultrasonography that is done depending on the disease that you have. And the person who's doing the ultrasound must also have undergone a certain type of training to be able to actually pick endometriosis. So just because an ultrasound was done and they did not pick anything, it does not mean that you do not have endometriosis. We need to understand who did the ultrasound and what was their experience and training in as far as doing ultrasonography for endometriosis is concerned. So that is one of the gaps that we have in this country, that there is very little training, although there's a lot of advocacy now, and the gynecologists are going through a lot of training to be able to actually understand and be able to do these ultrasounds for endometriosis. But there are very few centers currently as we're speaking that can actually be able to do ultrasonography to pick deep infiltrating endometriosis, and even worse, superficial endometriosis, which is even harder to pick using ultrasounds. MRI is a good option, but even the person who's interpreting the MRI must have had it in mind what to look for when they're doing MRI for diagnosis of endometriosis. So for her, I'll advise that she tries and seeks a center that deals with endometriosis, because not everyone who's doing ultrasonography actually has the experience and the skill to do ultrasonography for endometriosis.
Right.
Yeah.
Let's go back to the conversation on infertility, because I'm pretty sure even for the number of callers that we have had and those that we're going to have, they're going to resonate around that. There's something that you'd mentioned, the endometrioma, the cystic ovarian endometriosis found in the ovaries. So for this one, for a patient who has been told that she has endometriosis around the ovaries, are they more susceptible for matters in fertility rather than others? You also mentioned the fallopian tubes. So for example, someone has, let's say, in the brain, are they not as susceptible for matters in fertility? Help us understand this.
So if endometriosis is going to cause infertility, it is going to involve the reproductive organs.
Okay.
So it can affect the uterus, it can affect the ovaries, it can affect the fallopian tubes, or even the cervix, or the vagina itself, okay? Or the structures around the pelvis itself.
Right.
So if these structures are involved, then the chances that you're going to have infertility is actually quite high. Just to put it into picture, for a normal couple that is healthy, normally the chances of conception is about 15 to 20% for people who are engaging in regular coitus.
Okay.
For people with endometriosis, normally it drops to about 5 to 10%, depending on the degree of endometriosis. Wow. And some of them actually have infertility to an extent where the tubes are so damaged they can actually not conceive. But when you're talking about the brain, then it depends which part of the brain has been affected by the endometriosis for it to be able to cause infertility. Okay. Yeah.
So now for the surgery, because again, we've had people say that I've undergone even more than 20 surgeries, as Joy was saying. So what happens in these particular surgeries? Let's say, because you're saying, let's say for the specific locations. So what happens really? Help us understand the whole purpose of each and every single one of these surgeries, that one has to again go back to to undergo the surgeries.
Yeah. So endometriosis does several things. Okay. So one, as we said, it causes what we call adhesions. Okay. Yeah. And then it also forms, for superficial endometriosis, you form nodules. So they are actually thickenings of endometrial cells and endometrial stroma. And these adhesions actually distort the normal anatomy of the pelvis. Okay, so it damages the ovaries, it damages the tubes. And when you're talking about ovarian endometriosis, they actually form collections, cystic collections, with endometrial and inflammatory matter inside it. So the surgery, when it is being done, it actually involves correcting this. Number one, it serves the purpose of making the diagnosis.
Could I interrupt you a bit? I know we'll come back to the whole surgery just to understand it. But let's pick this call. Wangoi, we live from Ngong. Wangoi, habari asubuhi?
Nzuri sana, habari ya ninyi?
Sisi tuko salama hapa studio. Asante sana for calling us. Uko na swali, uko na maoni?
Okay, niko na swali. Me, I'm asking,
yes,
can a woman of 60 years have endometriosis? Kwa sababu I've been having pain on my right side,
okay,
next to the umbilical cord, along the pelvic.
Right.
This pain has been there for some time, so many years, and wherever I've gone to hospital, they are telling me I've been tested, UTI, I have been tested, picha ya mgongo, I've been tested kidneys, sugar, and nothing has been seen. What could be my problem?
Okay, so what can be the problem, as well as can a 60-year-old woman have endometriosis? Right, kama credit measures. Thank you very much, Wangoi, for calling us this morning. Salimia to Ngong. 0795-045-864 is the number to call us live. 0793-267-279 is our WhatsApp number. Talk to us, ask us all those questions regarding this conversation, endometriosis, and Dr. Sam will be answering them. So even before we go back to the conversation on surgeries, you can help Wangui settle her mind of this.
Yeah, so at a postmenopausal age, we know that endometriosis is a hormone-dependent disease, specifically on estrogen. So women who are at menopause have very low levels of estrogen. But if they had endometriosis prior to their menopause, then they must have already gone through the process of injury to the pelvic structures, distortion and formation of adhesions, and the nodules may still be there because the nodules don't abate or disappear because you do not have the hormone anymore. So it is possible if she had endometriosis, because there are many reasons also why a menopausal woman would have pelvic pain, which is quite different from the women who are having pain because of endometriosis in their premenopausal age. So again, it boils down to the type of diagnosis that is being made. And I think you're already picking that we are talking a lot about the lack of expertise and experience in terms of endometriosis. And there's a lot of advocacy now and training that is going on, because initially endometriosis was actually thought to be the Western world disease.
And it reminds me, because even for Njambi, she really had to undergo some of this, most of the surgeries outside the country. And even calling for the president to really, take a look at this. Is it that even as a country, if someone has endometriosis, they can't really undergo the surgeries in the country, a full surgery, and the chances of even it recurring might really be less?
Well, no, that's not true, because one of the challenges beyond the skill set to doing the surgery is because now we have doctors who've actually been trained and they can be able to do very adequate surgery, laparoscopic surgery for endometriosis. But the challenge is, surgery is not a question of just the doctor. Okay, there's also the setup that is required. So the laparoscopic setup to do endometriosis are very few in this country. For example, if we look at government hospitals, which is the most common places where our patients are going to when they have these kind of conditions, how many gynecologists do we have in these centers? And then in these gynecologists, how many are actually trained to do laparoscopic surgery? And even when they're trained to do laparoscopic surgery, how many of them, like which county are we in right now? We're in Kiambu County, right?
Yes.
You can imagine in the whole of Kiambu County, we do not have a government hospital that has a functional laparoscopic unit. And so where are all our patients with endometriosis supposed to go to, and especially those in low-income communities that can't afford it? Remember, the treatment of this condition, the surgery, is also very expensive. So we need to do a lot of advocacy, and a lot of government initiative is supposed to be brought in so that we can be able to actually have proper setup to manage endometriosis.
Right. Let's pick this call. Nairobi hapa tu. Doreen, habari asubuhi. Doreen, if you can get me. Yes, good morning.
Good morning.
How are you doing this morning?
Hello.
Kama tumepoteza Doreen. Doreen, unaweza piga tena tafadhali, and so that maybe it was a very important question, and actually would have got into it. So even as we continue on this conversation, so the International Journal for Gynecology and Obstetrics says women with a history of endometriosis must be informed of possibility of disease occurrence. Is this something that even as someone, a patient came to you, is this something that you're obliged to tell them that, well, there's a possibility that it is going to recur, and this is what you need to do?
Yes. So because there's no cure, but there's treatment to the symptoms, and the treatment involves managing the pain. It involves, ensuring that these women still have a fertility component just like any other woman, and it also involves keeping the pelvic structures the way they are supposed to be, so that we minimize the damage to the pelvic organs. So any patient who presents with symptoms of endometriosis and they undergo treatment, they should be made aware that I have not given you a cure. It's something that requires long-term follow-up and treatment, so that we can manage these symptoms to an extent where they have a proper quality of life, just like the other women.
Right. Let me take you all the way to Diani, where Monica is. Monica, habari asubuhi kutoka Diani.
Yeah, good morning.
Good morning. How are you doing this morning?
I'm good.
Thank you for calling us. Do you have a question or a comment on this conversation?
Yeah, I have a question.
Okay.
Yeah, what I wanted to ask is, how do you differentiate between normal endometriotic pain,
okay,
and just the normal periods. Because I remember nikiwa mdogo kidogo vile nilianza periods, I used to have very, very painful periods.
Right.
Then with time, they subside. Then kuna this pain that comes after when I'm ovulating.
Right.
I normally have very, very painful ovulation.
Right.
Like siwezi tembea, siwezi fanya anything. Like nikiamka hivi lazima niamke, niiname kidogo ndio niamke.
Okay.
Yeah. So is that connected to endometriosis or what is it?
Okay, thank you very much for that question, Monica. Dr. will be giving you an answer on the same. Salimia sana tu Diani. Is there a difference, Dr.?
I think I'm happy now that that people are getting concerned, and every woman who's having pain is getting concerned, could I be having endometriosis?
Yeah.
I think that's a step ahead that you're making in advocacy. Pain during menses is called dysmenorrhea, okay? And like I said, there are different types of pain. So there's a primary one, where women are experiencing it because the uterus is contracting during the process of menstruation. And then there's the one which we call chronic pelvic pain, secondary dysmenorrhea. And this is caused by diseases or pathologies of the pelvis. So not all pain that you will experience is because of endometriosis, but there are many other conditions that may cause pain in the pelvis. Remember, we have so many structures around here.
Yeah.
Okay? So there's no way of differentiating pain of endometriosis from pain of other conditions that related to the pelvis. Even in endometriosis itself, the pain is not characteristic. There's no type of pain you can say that I'll say with 100% surety that this is endometriosis, because they present in different locations in the pelvis. They present in different severity, okay? So some of them may even just present with back pain, low abdominal pain, pain during menses, or pain throughout the month, irrespective of whether they're having their menses or not. So because of this vagueness of presentation, it's very difficult to point out for her that this is actually the reason why you're having this pain. She needs to have actually a proper investigation and just a sit down with a doctor so that they can be able to understand where this pain is coming from.
Right.
Yeah.
So, but then it means, because the kind of questions you're really getting is, I have this pain, I've been having this pain for quite a long time. So is it time, and I think even just speaking from most of these questions is, then is it time for me to go and visit a specialist to actually confirm
what is
yes.
Yeah, I think that is a take-home message. Number one, I know she's mentioned something very interesting, that is it normal pain or is it pain that I should go and see a doctor about? And I normally want to make it very clear that women were not brought to this world to feel pain.
Yeah.
So there's nothing like normal pain. Yeah. Let us start from there, okay?
Oh yeah, so because she actually started with that.
Normal, yeah, you know, because that tells you the socialization that we have given our women and even our children at school, that it is normal for you to feel pain during menses. So I think there's a lot of advocacy that needs to be done, and it should start from the girls' schools. We should be able to inform the teachers and the parents and the girls that it is not normal for you to experience this type of pain to an extent where your quality of life is impaired. So if you're missing class, if you're always in getting injections for painkillers and such things, then you need a medical attention.
Right. Yeah. We have Wangoi back on the line, I believe, kutoka Ngong. So you come, it's the same Wangoi, but Wangoi, very good morning to you.
Hello.
Yes, good morning.
I've come back because I feel my question was not answered because my problem is I have never been diagnosed with endometriosis, and I'm 60 years. But I have been having pain, which is not going. And I have been tested so many things, and nothing has been seen. And that is the reason why I'm coming back, because I don't know what is bothering me. Because this pain, it is not sharp pain, but it has always been there. And you people, you are advising us whenever we feel pain, you go to hospital, and that's the reason why I've been going to hospital, and nothing has been diagnosed.
Right. Could you, could I allow Daktari to engage with you on air live so that...
Sorry?
Could I allow Daktari to engage with you live ndio, so that you can clarify?
Nimeangaliwa, nimepigwa picha ya mgongo, nimeangaliliwa sukari, nimeangaliliwa kidneys, nimeangaliliwa, yani nikienda tu napatiwa tu dawa. Hata saa hii nakunywa tu dawa tu hapa, naambiwa inaitwa ni urinary alkalizer and antacids. Mimi sasa sijui ni nini hizi.
Right. Daktari, unaweza muuliza swali?
I think I don't have the full picture because to be able to determine hii shida yake iko wapi, there's a process that we normally follow. So number one, I will need a very detailed history. When did this condition start? When did she start feeling this pain? How long has she felt it? Does it reduce on some occasions? Does it increase on some occasions? Is there a position that when she is, the pain is actually there more, okay?
Okay.
And then after I get all this history, then there is also the examination that is involved. Because we don't just talk to you and then we tell you this is what you have. We need physical examination.
Right.
The physical examination involves examining the abdomen so that we can be able to feel, are there any masses? Is there a place that when I touch you're actually feeling pain? Where exactly can we pinpoint where this pain is? And there's also vaginal examination and probably rectal examination that is involved.
Right.
And then there's the ultrasonography if need be. And if that doesn't work, then now we go to, there are some blood tests that we can do, and we can even go to an extent where we say, now let us go and do laparoscopic diagnosis.
Right.
Laparoscopic diagnosis is normally very, invasive.
Right.
So we take it as a last option.
Okay.
Once we go through this, then we can be able to tell her for sure that this is exactly what you have.
Right.
So I don't really have the history of what type of treatment she has been undergoing to.
Come up with
has she been seeing a specialist
for
this condition, or has she been seen by someone who is a generalist? Because the quality of treatment that you get also depends on the center where you go from.
Right. Declare, due to the interest of time, because I know there are still more callers who will be calling in to ask all these kind of questions, but probably leave us a contact so that they can pick it up and ask you all this questions.
Yeah, sure.
Even as you also give an advice to women with endometriosis, what they really need to know. A takeaway, a brief takeaway.
Yeah. So we are getting so many questions, and it's coming up that pain is actually a very big concern for women.
Yeah.
And some of them are actually starting to realize that pain is not a normal thing. So my advice to them is that if you are experiencing pain that is impairing your quality of life, if you're experiencing pain that is, excruciating and taking you to hospital, if you've been trying to get pregnant for a certain period of time and it is not working, or if you are having, trouble at home, in the bedroom with your partner because of pain during intercourse, then it is time that you consider attending a facility that is specialized in endometriosis.
Right.
Yeah.
Thank you very much.
Thank you.
Daktari, for giving us all these tips that we need. Edo Aska amekubaliana nayo, says Daktari is right. We tend to believe it's right to have painful menses. Antidote the thing has been disturbing me for sure. Give us your contact.
0717 059 419.
Unazirudia pole pole.
0717
yes.
059 419.
Okay.
Right.
Thank you very much, Dr. Bruce Semo, an obstetrician, as well as a gynecologist, on giving us these tips, understanding endometriosis. This conversation continues on our digital platforms.